Hello, and welcome to the Clinical Care Options Infectious Disease podcast. I'm your host, Jessica Adams. In this episode, Dr. Jean-Michel Molina presents a case-based discussion on on-demand PrEP as a strategy to support PrEP persistence and engagement for cisgender men. Dr. Molina is a professor of infectious diseases at University of Paris, Cité, and head of the Department of Infectious Diseases at Hospital Saint-Louis and Lariboisière in Paris, France. For the full online educational program, Staying on Track, Strategies to Support PrEP Persistence and Reengagement, please visit the link in the show notes for this episode. Now let's hear what Dr. Molina has to say.
Let's look at this case. This is a 52-year-old cisgender man who has been on oral PrEP with TAF FTC daily for the last 3 years. And he's reporting challenges to adhere to his daily medication, and therefore is considering discontinuing PrEP since he has infrequent sex, approximately 2 times per month. His HIV test is negative. The other tests for STIs also returned negative. The screen for chlamydia, gonorrhea, the serology for syphilis, hepatitis B and C. His eGFR is 60 ml per minute. He has a pretty high LDL cholesterol, high A1C, high blood pressure, and high BMI. So his physician is considering also starting a statin and treatment for high blood pressure. Data from the Kaiser Permanente cohort look at the impact of PrEP discontinuation on HIV incidence. HIV incidence is high in people who have started PrEP and did not restart. In those who stopped and did not restart, the HIV incidence is 1.28 per 100 person years of follow-up, whereas in those who were persistent on PrEP, the incidence of HIV was 0, and also very low, 0.28 in those who stopped PrEP but then restarted PrEP. So it is critical in someone who is struggling with adherence to PrEP to find ways to maintain adherence to PrEP in order to avoid HIV acquisition. So let's look at the different PrEP options that are available for cisgender men today. We have daily TAF FTC, daily TDF FTC, and we also have non-daily options, on-demand oral TDF FTC or 211 with oral TDF FTC, and more recently, injectable cabotegravir every 2 months. Regarding on-demand TDF FTC for MSM, the data supporting the use of these dosing regimen are based on the data from the ANRS IPERGAY trial, which was a double-blind placebo-controlled trial of on-demand PrEP with TDF FTC in men who have sex with men in France and Canada. In the first placebo-controlled phase of the trial, the relative risk reduction of HIV incidence was 86% with on-demand TDF FTC as compared to placebo. This was highly significant. And in the open label extension phase of the study, the relative risk reduction with on-demand TDF FTC was 97%. So very high effectiveness in this trial. So people have to start with a loading dose of 2 pills, which have to be taken 2 to 24 hours before sex. Then after sex, you took a third pill 24 hours after the first intake. And the last pill has to be taken 48 hours after the first intake. So on-demand TDF FTC for PrEP has been recommended for MSM, but is not recommended in case of HPV co-infection, in individuals who have difficulty adhering to the 211 dosing regimen, and in population at risk of HIV acquisition from vaginal exposure, because we don't have any data at this point to recommend on-demand TDF FTC in those cases. Let's review now some data supporting the use of on-demand PrEP with TDF FTC in the real world, and try to see what's the data comparing on-demand to daily. Although these were not randomized comparison. So first, the ANRS Prevenir cohort, which is an observational cohort of men who have sex with men, in France using either on-demand or daily. And these men had the choice to use either one and could actually switch between the two dosing regimens. And in this cohort of more than 3,000 men with a median follow-up of 20 months, with a 40% switching between daily or on-demand over time, the overall HIV incidence was very low, only 1.1 per 1,000 person years of follow-up. And when you look at these people having breakthrough HIV infection during the study, only 3 had breakthrough HIV infection in those using on-demand, and the same number 3 also in those using daily PrEP. So very, again, similar results, supporting the similar effectiveness of on-demand and daily. Data from 2 European PrEP demonstration projects in Belgium and the Netherlands, also among MSM. In these cohorts, only 25.9% of those men choose on-demand. The others choose daily. But still, 31.7% during the study switch between daily and on-demand. And after 28 months of follow-up, only 2 breakthrough infections were diagnosed, both in people using daily PrEP. Another cohort was also conducted among MSM in West Africa. In this observational prospective study, MSM were offered to use PrEP with either on-demand or daily TDF-FTC. And interestingly, in this cohort, 74% of the men chose on-demand PrEP. In the primary analysis of the data, the number of breakthrough infections were higher with on-demand. When you look at the adjusted incidence rate ratio, it was nearly 4, but the difference was not significant because, again, most men were using on-demand. In a follow-up analysis recently published, there was an increase in the number of breakthrough infections with on-demand. And here, the adjusted incidence rate ratio was just significant. But when you look at the HIV incidence, you could see that it was 2.4 with on-demand, 0.6 with daily, but much higher, 7.9 with no PrEP in this cohort. And what the authors also reported was the adherence to the dosing regimen was lower with on-demand as compared to daily. And when they measured drug concentration in participants who seroconverted, up to 98% of the plasma drug concentration were undetectable. Again, underlying the importance of adherence, and that in this case, seroconversion occurred because people were not just taking PrEP. Finally, data from China in a real-world cohort in China of nearly 2,000 men who had sex with men and transgender women. Interestingly, 57% prefer to use on-demand PrEP. And in a review and meta-analysis of studies presenting data for PrEP discontinuation, it was interesting to see that people who were offered both daily or on-demand had a lower discontinuation rate as compared to those offered only daily. So let's go back to our case now. So in this individual, again, having used TAF-FTC daily for the last 3 years for PrEP, he is now 52, has a high blood pressure, high BMI, high A1C, high cholesterol, low eGFR. And what would you suggest in terms of not daily options? Oral TDF-FTC given on-demand or injectable cabotegravir are the only 2 non-daily options that can be proposed today to these gentlemen. And indeed, we don't have any data right now with on-demand TAF-FTC, so this is not an option at this point. Also, on-demand can be proposed to people who have renal issues with daily TDF-FTC, and we will go back to that in a second. And we've seen that these participants had BMI and hypertension, and indeed there are data now suggesting that people using TAF-FTC have an increased risk of hypertension and statin use as compared to those using TDF-FTC for PrEP. And also data from Discover and HPTN 083 suggest that with TAF-FTC or with cabotegravir, you have an increased body weight over time as compared to those using daily TDF-FTC. So this is to keep in mind when you have to propose options to your patients coming to get a PrEP prescription. And the more pills you take, the lower the creatinine clearance is, which is not surprising. And indeed, also in the PREVENIR study, it was shown that with on-demand TDF-FTC, you had a lower impact on eGFR than when you use daily dosing. These are small differences, but in individuals who have low eGFR, these can be clinically relevant. And indeed, in a recent study reported in the UK, where people were referred to a consultant because they had issues with PrEP, and most of these issues were related to renal issues, they suggested that switching to event-based PrEP or on-demand PrEP was one way to manage renal dysfunction in people who were using previously daily PrEP with TDF-FTC. The study from the Kaiser Permanente in California suggesting that there might be an increased risk of hypertension and an increased use of statin in people using TAF-FTC for PrEP as compared to those using tenofovir-FTC. And this is a study conducted among nearly 2,000 individuals. People using TAF-FTC were matched 1:4 to those using tenofovir-FTC, and the cumulative incidence over 2 years of hypertension was 2.2 with TAF-FTC and only 1.3 with tenofovir-FTC, with an odds ratio which was significant. And the same was true when you look at the incidence of statin initiation, 1.6% versus 1% with TDF-FTC, so an odds ratio of 2.33. So these are data which you may want to consider when you have to choose between PrEP regimen in a patient. Finally, in terms of body weight, and people care about body weight today, data suggesting that with TAF-FTC, the body weight increased by 1 kilo on average after 48 weeks as compared to TDF-FTC given daily. And again, with cabotegravir, you could see also that there was a mean increase in the body weight of about 1 kilo after about 2 years in this cohort. So in this case, the patient was given the option of the 2 non-daily regimen, so on-demand TDF-FTC or injectable cabotegravir, and it chose on-demand TDF-FTC. So it was counseled on how to use on-demand TDF-FTC with the 2-1-1 dosing regimen. And the patient was instructed to continue, and that's important, a daily pill of TDF-FTC until 48 hours after the last sexual intercourse. And clearly, in this case, you need to monitor eGFR because the patient had a low eGFR to start with, to monitor blood pressure, to make sure that you don't need to start drugs for blood pressure. Monitor proteinuria to make sure that you don't have, tubular dysfunction, body weight, and LDL cholesterol. And indeed, advise on a diet and exercise to try to, improve blood pressure, body weight, and LDL cholesterol. So what are the key take-home messages from this case? Well, today we are lucky we have multiple options for PrEP for MSM. And we know that when we have more options, people are, more likely to persist on using PrEP. In terms of non-daily options, we have 2 choices today, on-demand TDF-FTC or injectable cabotegravir. There are a number of data now suggesting that on-demand TDF-FTC is as effective as daily TDF-FTC when it is taken as recommended. And people actually can switch between options, which is actually practical and can, make people comfortable with their sexual activity. And we, reported that in the PREVENIR PrEP study, nearly 40% of the individuals actually switch between these 2 PrEP options. With that, I'd like to thank you for your attention with this case.
Thank you very much to Dr. Molina, and thank you to our listeners for joining in. To get more from our program, see the link in the show notes. You can view a foundational video module on PrEP persistence, more vlogs featuring specific case examples, clinical thought commentaries from people using PrEP, and downloadable PDF resources for healthcare professionals to print and share. Please be sure to check back regularly for more episodes on important infectious disease topics. Thank you and have a great day.